Veterans lose $49,440 to Medicare over 20 years. That's assuming premiums stay flat and never go up, which they won't. The real number could be over $80,000. You've already paid into Medicare your whole working life through FICA taxes. Now you're paying again. That's not fair. But imagine watching your retirement savings drain away, knowing year after year that there was a better way. It doesn't have to feel like this. Your friends who figure this out, they're keeping more of their Social Security every month. I'm Chris Duncan. I wrote Medicare for Veterans. You can read it free at freevetsbook.com or buy it on Amazon. With nearly 20 years of Medicare experience, my team and I work exclusively with veterans. Medicare rules make our services completely free to you. Let's start with the base calculation. Medicare Part B is $206.50 per month in 2026. Multiply that by 12 months, you get $2,472 per year. Multiply that by 20 years, you get $49,440. But that's just using 2026 numbers for all 20 years. Here's what we know. Medicare premiums don't stay flat. They've increased an average of 5 to 6% annually for the last 2 decades. In 2005, Part B was $78.20 monthly. In 2015, it was $104.90. In 2025, it's $185, and in 2026, it jumps to $206.50. The pattern is clear. Medicare premiums more than double every 20 years. Think about this. If you retire at 65 in 2026, by the time you're 85, you could be paying $400 to $500 monthly for Medicare Part B alone. And here's what makes this frustrating. You've been paying Medicare taxes your entire working life. It's called FICA. You remember the FICA box on your pay stubs? That money went to Medicare and Social Security. Let me show you the real math. If you earned $30,000 average over 40 years, you contributed $34,800 to Medicare. If you earned $50,000 average, you contributed $58,000. If you earned $75,000 on average, you contributed $87,000. And if you earned more, you paid more. My dad, Wallace, he worked for 40 plus years. He paid in tens of thousands of dollars through FICA. Now he's 82 years old, and Medicare Part B premiums are $206.50 every month. My dad and thousands of our clients use strategies so they're not overpaying the standard $206.50 for Medicare Part B while gaining additional benefits. Not free government health care. Benefits they've earned through FICA. Benefits they deserve because they paid in their whole working lives. Imagine if you didn't know these strategies existed. You'd just keep paying full price month after month, year after year. So how does he do it? My dad is 82. He's a Vietnam-era veteran, and he's been on Medicare since he turned 65 in 2008. That's 17 years of premium so far. Here's what he does differently than most veterans. He pays exactly what Medicare requires for Part B, but he's maximizing every benefit he's earned through his FICA contributions and his military service. He's getting the absolute lowest Part B premium cost while receiving maximum benefits. He's not wasting the money he paid into Medicare his whole working life. These are strategies he's earned from all the taxes he paid into Medicare through FICA. Strategies that have nothing to do with his income level. Strategies that thousands of our clients use, including clients making tens of thousands a month. My dad uses both VA and his Medicare option. VA for certain things, his Medicare option for others. They're separate systems, but he has access to both. One doesn't replace the other. The key is making sure you enroll at the right time to avoid the penalties and obtain the lowest Part B premiums possible and gain additional benefits the VA, Medicare, and TRICARE don't provide. Most veterans don't know that's even possible. They just accept whatever bill Medicare sends, or worse, they delay enrollment thinking their VA coverage protects them, and it doesn't. Picture yourself in 5 years paying hundreds more per month than you have to. simply because you didn't know these strategies existed. And that leads to the biggest mistake veterans make. Here's the number one reason veterans don't enroll in Part B at 65. They don't know about the strategies to pay the lowest Part B premiums possible. They think Medicare Part B is just another $206.50 monthly bill on top of everything else, so they skip it. And that decision creates a permanent penalty. Medicare Part B has a permanent late enrollment penalty. It's 10% for every 12-month period you were eligible but didn't enroll. And the penalty lasts your entire life. Let me show you the math. If you delay 3 years, that's a 30% penalty. Instead of $206.50 monthly, you're paying $268.45. That's $62 extra per month. Over 20 years, that's $14,880 in penalties alone. If you delay 5 years, it's a 50% penalty. $206.50 becomes $309.75. That's $103.25 extra every single month. Over 20 years, that's $24,780 in penalties. You're paying for a mistake that you made decades ago. And here's the worst part. As premiums increase, your penalty increases with them because it isn't a fixed dollar amount. It's a percentage of the current year's Part B premium. In 10 years, when Part B is $400 monthly, your 50% penalty makes it $600. You're paying $200 extra every month because you delayed enrollment at 65. I believe this penalty system is wrong, but it is the law, and it's not going away. Imagine carrying that financial burden for the rest of your life, knowing one phone call at 65 could have prevented it. Bottom line, don't be that guy. Now, some veterans think VA coverage protects them from penalties. And if you want to see how much Medicare takes from your Social Security check in 2026, click the card in the top right-hand corner now. I have made a whole separate video about this. Here's what you need to understand. VA healthcare coverage does not qualify as creditable coverage for Medicare Part B. That's not my opinion. That's direct from va.gov. The VA's official website states, we recommend you enroll in Medicare Part A and B when you're first eligible. Not if you want to, not when you need it, when you're first eligible. They recommend it no matter if you are 0% rated or 100% rated. Why would the VA recommend you pay for Medicare if VA coverage is so comprehensive? Because the VA knows their own funding can change. Quote from va.gov, VA funding could change in the future. We may increase or decrease your compensation. The VA is telling you their funding isn't guaranteed. Enrollment priority groups change. Access can be restricted. Copays can increase. They know that relying only on VA healthcare can leave veterans vulnerable. My dad uses both VA and his Medicare option. VA for certain things, his Medicare option for others. They're separate systems, but he has access to both. One doesn't replace the other. The key is making sure you enroll at the right time to avoid the penalties. Think about this. If the VA changes their enrollment priorities next year, what if your access is restricted? You're already stuck with penalties if you didn't enroll at 65. We get calls from veterans every day that didn't enroll in Medicare at 65, and now they are 70 or 75 and realize that VA health benefits aren't enough. When we tell them what the premium will be after the penalties, it is simply unaffordable. It's heartbreaking. Your buddies who got this right, they're not worrying about any of this. They enrolled at 65 and moved on with their lives. So let's look at the real long-term cost with premium increases. Here's where the $49,440 number becomes $80,000 or more. I'm going to use conservative projections. Let's assume Medicare Part B premiums increase 5% annually. That's actually lower than the historical average, but it makes the math cleaner. Year one in 2026, that's $206.50 monthly or $2,478 annually. Year 5 in 2030, $265 monthly, $3,180 annually. Year 10 in 2035, $340 monthly or $4,080 annually. Year 20 in 2045, $561 monthly, $6,732 annually. And those 20 years together with 5% annual increases, the total is $82,080, and that's with conservative assumptions. If premiums increase 6% annually, which is closer to the actual historical average, the 20-year total exceeds $90,000. You probably actually paid more than $58,000 into Medicare if you earned over $50,000 on average. And now you're paying premiums on top of that. You're essentially paying twice, once through FICA taxes during your working years and again through premiums during retirement. Bottom line, most veterans are paying way more than they have to. And I haven't even mentioned IRMA yet. That's income-related monthly adjustment amount. If your income exceeds certain thresholds, you pay surcharges on top of the base Part B premium. In 2026, if your modified adjusted gross income exceeds $109,000 as an individual or $218,000 married filing jointly, you're paying extra. These are projected amounts for 2026. They could vary a little bit when finalized. At the first IRMA bracket, you're paying an extra $82.60 monthly. That's $289.10 total for Part B. Over 20 years, that's $19,824 in additional costs. Your lifetime Part B cost goes from $82,000 to over $101,000. At the highest IRMA bracket, you're paying an extra $495.60 every month on top of the base premium of $206.50. That's $702.10 monthly. Over 20 years, that's $118,704 in additional IRMA costs alone. Your total Part B premiums could exceed $200,000 for 20 years of coverage. And remember, IRMA is based on your tax return from 2 years prior. Had a one-time income spike from selling property, taking a big retirement distribution, or receiving a bonus, you're paying higher premiums for the next year, even if your income drops back down. In my opinion, this IRMA system punishes people for financial success, but you can plan around it. Envision this scenario. One poorly timed $50,000 IRA withdrawal pushes you into a higher IRMA bracket for a full year. That single decision costs you thousands in higher Medicare premiums. Strategy 1, enroll at 65. Avoid penalties at all costs. A 50% penalty over 20 years costs you an extra $25,000. Never delay Part B enrollment unless you have credible employer coverage from a company with 20 or more employees. Strategy 2, make sure you're not overpaying. Most veterans don't know there are strategies to pay the lowest Part B premiums possible while maximizing benefits. Strategies they've earned from all the taxes they paid into Medicare their whole lives. My dad uses these strategies. Thousands of our clients use these strategies. You should be using these strategies as well. Strategy 3, plan for IRMA. If you're approaching $109,000 income, consider timing retirement account distributions, Roth conversions, or other income events to stay below IRMA thresholds. 1 year of bad tax planning can cost you thousands in higher Medicare premiums. You paid into Medicare through FICA your entire working life. You earn these benefits through your military service. Make sure you're getting everything you paid for while paying the minimum necessary. Picture your retirement. You're keeping more of your Social Security. You've got backup coverage beyond VA, and you're not worried about Medicare penalties. That's the peace of mind these strategies provide. Your buddies who got this right, they're not worrying about any of this. They enrolled at 65, are receiving the lowest possible Part B premiums, receiving additional benefits, and moved on with their lives. Let me tell you about Rick. Rick, he's a friend of mine for over 20 years. He's a 100% disabled Vietnam veteran. When he turned 65, some people told him he didn't need Medicare because he's 100% disabled. That's wrong. Here's the data. Rick enrolled in Medicare at 65. He uses VA healthcare for most things. Because of his 100% disability rating, he gets certain VA benefits, but he uses the additional benefits from the strategies we've been talking about to get extra services where there are long waits for VA-approved providers or when he wants services the VA won't cover. And here's the key. Rick gets maximum VA benefits. maximum Medicare benefits while paying the absolute lowest Part B premiums every month and gaining additional services the VA, Medicare, and TRICARE don't provide. He's not overpaying. He's not leaving money on the table. He's not putting himself at risk for Medicare penalties. He understands how his Medicare option and VA complement each other. If a 100% disabled veteran needs Medicare as backup coverage, every veteran needs Medicare as backup coverage. Your disability rating doesn't protect you from Medicare penalties. Your VA access doesn't replace Medicare enrollment requirements. Rick feels secure. He's got VA when he needs it, Medicare when he needs it, and he's not paying more than he has to. Imagine Rick's buddy who skipped Medicare at 65. Now he's 70 with a 50% penalty. They're both 100% disabled, but one is paying hundreds more per month for the same coverage. Think about where you want to be at 70. Do you want to be like Rick or like his buddy? My book, Medicare for Veterans, has an entire chapter on strategies to minimize Medicare costs. You can read it free at freevetsbook.com, or if you want the physical copy, grab it on Amazon. There is a link in the description. I believe every veteran deserves to know these strategies. You earn them through your FICA contributions and your military service. If you want to talk to someone on my team about minimizing your lifetime Medicare costs, call us at 888-960-VETS. That's 888-960-8387. I've made other videos that break down exactly what you need to know. Check out my video, Why VA Won't Tell Veterans About Losing $258 Yearly. The link is in the description. Imagine the peace of mind knowing you're not overpaying, you've got backup coverage, and you're penalty-free. It feels right when veterans get what they've earned. And Medicare rules enable us to provide all of our services completely free to veterans. And you can see what other veterans say about working with us at our testimonial page. Again, the link is in the description. Your buddies who've worked with us, they tell you it was worth the call. Don't lose $49,440 to $80,000 over 20 years without making sure you're getting everything you've earned. You're seeing two videos on the screen right now. Pick one to expand your knowledge about Medicare for veterans, and make sure you're subscribed because I'm releasing more veteran Medicare education videos every week. Thank you for watching, and remember, we speak veteran.